Hello, it's Dr. Rhonda Johnson, and today is Tuesday, November 1st, 2022. Can you believe it's November already, folks? Well, today I am talking about COVID and the flu. So what is 70,000? Well, this is the upper limit of the number of COVID deaths that forecasters are predicting for this winter. Forecasters say that anywhere between 30,000 people to 70,000 people may die from COVID this winter. Now, as President Biden said on October 25th, this year nearly every COVID death is preventable. While that may not be true, but a lot of these deaths could be prevented. As of today, folks, only 19.4 million Americans have received a bivalent COVID booster shot. That's just 6% of the eligible people for the shot, which is free and available to everyone ages 5 years and up. A reminder as to how we can prevent COVID through use of vaccines, masking, improved ventilation, and distancing. We need all the strategies to really mount an effective mitigation response. Remember, more than 350 people continue to die from COVID every single day in the United States on average. I hope that everyone who is eligible will talk to their healthcare provider if you're unsure, or just go on and get the booster. Now, when it comes to COVID, the CDC COVID data tracker shows that the BQs, BQ.1 and BQ.1.1, are going to become the dominant variants in the U.S. in the next several weeks. And experts say the BQs will drive a winter wave of infection in the United States. But there are other variants out there. There's a whole mixture of variants, and all are Omicron offspring. Now, researchers say that the BQs are likely to be resistant to the monoclonal antibody treatments that we have right now, Evusheld and bebtelovimab. Next, I'm going to turn to the flu. Right now, according to the CDC, Influenza A, H3N2 seems to be the dominant flu virus right now. And sadly, one child has died from flu this week, according to the CDC. Now, the CDC estimates that so far this season, there have been at least 880,000, almost a million, cases of the flu. There are almost 7,000 flu hospitalizations and 360 deaths from the flu. And it's only November 1st. It's just going to get worse. So it brings me to question, did you get your flu shot yet? An annual flu shot is the best way to protect against the flu. The flu shot will help prevent serious outcomes in people who get it, but can still get sick with the flu. Now, the CDC recommends that everyone ages 6 months and older get a flu vaccine. Now is the time. You know, you can get your COVID shot and your flu shot at the same time. Most people give them in different arms. Now, there's a prescription for flu antiviral drugs that can be used to treat flu illness, just like Paxlovid may be helpful for high-risk people. Now, the flu antiviral drugs need to be started as early as possible. Now, remember, you can do a COVID home test for COVID, and there are a number of rapid influenza diagnostic tests commercially available. The flu and COVID present with very similar symptoms. Most people will not know which one they have. So, in closing, we have an early start to this viral respiratory season. It includes influenza A and B, RSV, the respiratory syncytial virus, which is driving all these hospitalizations in the pediatric population, other viruses, and COVID. Please use all your tools to stay well, and don't be one of the 30,000 to 70,000 Americans that are expected to die from COVID this winter. That's my message today. Please be well and be safe.